In 2001, I decided to join the fight against asthma by using my personal experiences with the disease as a spokesperson for the American Lung Association of New Jersey. Shortly afterward, I founded my own nonprofit asthma fundraising organization, A Matter of Life and Breath, through which I have raised over $20,000 to benefit research and asthma educational camps for children and programs, and ultimately, of course, to find a cure. When it came time to go back to school after being sick for so long, I was in need of funding in order to attend college. Through research for scholarship opportunities, I realized that the Miss America organization is the largest scholarship provider for women in the world. Since I had already had a talent, having played the violin since the age of 7, and I had a perfect platform of asthma education and advocacy, I entered and qualified to compete for the Miss New Jersey competition, an official preliminary to the Miss America competition. On June 17, 2006, I'm extremely proud to say that I won the title of Miss New Jersey and traveled the state and country as the representative of the Garden State, teaching all those with whom I came in contact about the great value of their ability to breathe. My status quickly jumped from state spokesperson to national spokesperson for the American Lung Association, specifically for asthma and tobacco control. While spreading the word about lung health to others, especially helping pediatric asthmatics to cope, my own health has remained a great challenge for me, despite my efforts. When I can breathe, I perform perfectly. But when asthma unexpectedly rears its ugly head, I then find myself ill with pneumonia for the 10th time, not being able to drive, walk, or talk. Asthma is frustrating, horrifying, depressing, embarrassing, and far too often fatal. That is why I believe it is so vital to keep asthma and its rising prevalence under control, and for all asthmatics to be in command of their disease rather than fall prey to it. I have proven time and time again that once this is achieved, all else is possible. As Miss New Jersey, it is well known that my work for patients' rights is extensive, and my personal story with asthma has certainly served as inspiration for many. However, there is a large part of my life and my treatment for asthma that no one other than my closest family and friends know about. About 10 years ago, my Uncle Tony was dying from cancer and suffering from wasting syndrome. His only rescue was from the debilitating effects of cancer treatments and cancer was the use of medicinal marijuana. It was his success with marijuana's medicinal benefits which initially struck my curiosity to the plant. After asking my own doctor about marijuana's benefits, I learned that when used appropriately, marijuana could actually provide relief for my most severe asthmatic symptoms, as the substance actually serves as a bronchodilator. Under this recommendation, I retreated to a safe environment, a controlled environment out of state, under the supervision of my family, and used marijuana medicinally for the first time via vaporization. At this point, I had been struggling to breathe constantly for 8 months. So when my airways opened up and I got immediate relief from the plant within 15 seconds, needless to say, I was shocked, I was extremely relieved, and so grateful for having finally found my miracle treatment. Unfortunately, though, upon returning to the state of New Jersey, I no longer had access to this medical marijuana due to its illegal status, and was forced to continue suffering from asthma every day, knowing very well all along that there is this miracle drug out there to save my life, and I could not, by any means, have access to it. That was and continues to be the most frustrating, helpless, and hopeless feeling of all. My aim is, and always has been, to educate the general public through continuing to work alongside the American Lung Association, as well as heading my own nonprofit fundraising organization, A Matter of Life and Breath. As Miss New Jersey, I have been an advocate on behalf of the 24 million asthmatics in our country, the diagnosed asthmatics in our country, and I have helped to establish national guidelines for proper diagnosis and treatment of asthma, and I've set national and international standards to improve quality of care. I return to Washington, D.C., as my brother Fred said before, each year to address Congress, encourage federal funding for asthma prevention and research programs, and to promote the strengthening of laws that protect patients' rights. Now, as I travel nationally with my mission to help everyone breathe easier, I am so proud to do so as an active volunteer and member and spokeswoman for NORML, New Jersey. I hope that my involvement with this organization and others alike will further my successful work for patients' rights. I believe wholeheartedly that everyone deserves a chance to breathe easier. I cannot stress that enough. And if I have my way, certainly everyone, at least in New Jersey, will breathe easier. Statistically, asthma accounts for about 14 million missed school and work days a year, 500,000 hospitalizations a year, and costs our economy approximately $14 billion annually to treat. Its rise in prevalence leads to higher costs each day. Most shockingly, asthma accounts for 12 deaths every day. And these are people who died from asthma episodes when their deaths were completely preventable had they had the access to a rescue drug. One of the key components for asthma control that goes completely unnoticed is pharmacological therapy, under which, of course, marijuana falls. Asthma is a silent epidemic. It cannot yet be cured, but it certainly can be managed, especially if marijuana is made available as an option for treatment for suffering patients. After all, asthma medications are meant to help reduce underlying inflammation in the airways and relieve or prevent symptomatic airway narrowing.